The next section picks up or starts off with this big table, 6-1, which lists the most common terms used to describe bone markings, and these terms are going to be used throughout the chapter with great detail. So I just took this picture off of that table, but there's a whole list of anatomical terms for you to familiarize yourself with, and you can lump these into a couple of different categories. For example, projections are typically areas where tendons and ligaments are going to attach, and they're these protrusions or projections, extensions of the bone, if you will. Depression, grooves, and openings, on the other hand, are typically where you'll have blood vessels and nerves pass through the bone. For example, this foramen right here, the supraorbital foramen, is a place where blood vessels are going to pass out onto the face, and nerves will innervate the face from that hole. But you also have this foramen over here, and even on the bottom of the skull you'll have a foramen magnum, and so this is going to be one of the spots where the spinal cord is going to exit the skull. So do take some time, make yourself some flashcards of each of those anatomical terms like process, ramus, trochanter, tuberosity, tubercle, crest, line, spine, head, neck, condyle, trochlea, facet, fossa, sulcus, foramen, canal, meatus, fissure, and sinus, and with all their definitions. Knowing the definitions is going to help you in lab when you're looking for these structures. So, we're going to start our whirlwind tour of the human skeleton. The skeletal system consists of approximately 206 separate bones and their associated cartilages, and is divided into the axial skeleton, pictured here in yellow, and the appendicular skeleton, which is pictured here in the lighter gray. The axial skeleton includes the skull, the thoracic cage, the ribs, the sternum, and all of the vertebrae in the vertebral column. The appendicular skeleton is going to include the pectoral girdle and the upper limb, the pelvic girdle, and the lower limb. So we're going to start with the axial skeleton, which provides a framework for support and protection of the brain, spinal cord, and organs in the ventral body cavity. It provides surface area for attachment of muscles that move the head, neck, and trunk, muscles that perform respiration, and muscles that stabilize elements of the appendicular skeleton. The most superior aspect of the axial skeleton is the skull, whose main role is to house the brain in the cranial cavity, the sense organs for sight, smell, taste, and balance as well. The skull is not just one bone, but approximately 22 bones that are pieced together to form the cranium and the facial bones. So we have 8 cranial bones that form a cranial cavity, which holds the brain. The remaining 14 are the facial bones, and these include all of their associated bones like the auditory ossicles and the hyoid bone. So we're going to start with the frontal bone, pictured here in kind of a light orange. The frontal bone forms the forehead and the roof of the orbits, or eye sockets. It also has the supraorbital foramen, which I pointed out on the very first slide of this section. The supraorbital foramen forms a passageway above each orbit for blood vessels and nerves. The frontal bone contains air-filled cavities above the orbit, pictured here in yellow, that are called the frontal sinuses. These are spaces that are lined with mucous membranes, and they connect to the nasal cavity. Next are a pair of parietal bones, one on each side of the skull, pictured here in kind of a maroon color, and they form the roof of the cranium. The coronal suture between the frontal bone and the parietal bones is one of the places where those two flat bones are going to connect or articulate with each other. The sagittal suture, which is not well pictured here, separates or is the place where the two parietal bones lock. It's kind of on the midline of the cranium. The occipital bone forms the posterior and inferior part of the cranium, and it does have the lambdoid suture where the occipital and the parietal bones are going to interlock. From the inferior view, you can see the foramen magnum that I mentioned earlier, and this surrounds the connection between the brain and the spinal cord. Also, there are occipital condyles seen here. These are the articular surfaces that sit on the first vertebra. A pair of temporal bones, one on each side of the cranium, are going to form part of the zygomatic arches and will house the ossicles of the middle ear. Squamous sutures are where the temporal bones meet the parietal bones. There are a few key bone markings on the temporal bone that I want to point out. First, here's the zygomatic process of the temporal bone that makes up one part or one half of the zygomatic arch. We also have the squamous suture, there it is, and the external acoustic meatus. It's also known as the external auditory meatus. This is the tunnel for your ear. We have the mandibular fossa, the mastoid process, and the styloid process of the temporal bones as well. Pictured in purple is the sphenoid bone, which forms the floor of the cranium, and it's kind of the bridge between the cranial bones and the facial bones. It has wings, if you will, if you could picture a butterfly here, or maybe a bird. The wings of the bone are going to form a central depression that form the sella turcica. This is going to house and protect the pituitary gland, almost like a saddle for it. The sphenoid bone contains a pair of sinuses called the sphenoidal sinuses, pictured here in purple. Just anterior to the sphenoid, the ethmoid bone forms part of the cranial floor, and it is pictured in green. It forms the medial surfaces of the orbits, and it is the roof and sides of the nasal cavity. The crista galli, or galli, of the ethmoid bone is projecting upwards or superiorly towards the brain, and the inferior cribriform plates has holes in it that allow for olfactory nerves to pass into the nasal cavity. Like the frontal and the sphenoid, the ethmoid bone contains ethmoidal sinuses, which are again pictured in green here on our lovely sinus model. The ethmoid has projections into the nasal cavity towards the nasal septum, and these are called the superior and middle nasal conchae, which are better pictured and labeled on this figure. So these nasal conchae extend down from the crista galli. Between the conchae, we have part of the nasal septum. So you can see that perpendicular plate extending down between those nasal conchae. So that's the most superior part of the nasal septum, or at least the bony portion of the nasal septum. The maxilla articulates with all other facial bones except for the mandible, and it forms the floor and the medial sides of the rims of the orbits, the walls of the nasal cavity, and the anterior roof of the mouth, sometimes called the bony palate. The maxillary sinuses are pictured on our sinus model in orange. These maxillary sinuses drain into the nasal cavity and lighten the weight of the bone. The palatine bones form the posterior surface of the bony palate in the roof of the mouth. The superior surfaces form the floor of the nasal cavity and the superior tips form part of the orbital floor. The vomer bone articulates with the paired palatine bones and forms part of the nasal septum. The nasal septum divides the cavity into right and left sides. The zygomatic bones, pictured in blue, articulate with the frontal bone and the maxilla, forming the lateral wall of the orbit. The temporal process of the zygomatic bone curves laterally and posteriorly to articulate with the zygomatic process of the temporal bone, and this completes then the zygomatic arch. The nasal bones, you have a pair of them pictured here in purple. The nasal bones form the bridge of the nose between the orbits and articulate with the frontal and maxillary bones. The lacrimal bone, pictured here in red, are found within the orbit and on the medial surfaces of that orbit. They articulate with the frontal, ethmoid, and maxillary bones. This is an anterior view of the nasal and lacrimal bones. Also in this figure, I have labeled the inferior nasal conchae, which project from the lateral walls of the nasal cavity, and their main purpose is changing the airflow to improve the sense of smell. The mandible is also known as the lower jaw. Its vertical process is on either side. It's called the ramus. It extends up towards the temporal bone. The posterior process of the ramus, the condylar process, articulates with the mandibular fossa of the temporal bone. Anterior, the coronoid process, is the attachment point for the temporalis muscle that closes or clenches the jaw. And so we've reached a checkpoint for the skull. Which bone of the cranium articulates directly with the vertebral column? Do you remember? Moving on then, the small U-shaped bone just inferior to the mandible is called the hyoid bone. It's the only bone in the body that does not directly articulate with another bone, and it's suspended from the styloid process of the temporal bones. It serves as an attachment for muscles of the larynx, pharynx, and the tongue. Many different centers of ossification are involved in the formation of the skull. As development proceeds, the centers begin to fuse, producing smaller numbers of composite bones. As the skull grows around the developing brain in utero, but at the end of pregnancy, the brain has enlarged faster than the bones of the skull. So at birth, the cranial bones are connected by areas of fibrous connective tissue called fontanelles, otherwise known as soft spots. And these flexible fontanelles will allow for easier delivery of the head and for that brain to continue to grow. Typically by age 4, the fontanelles are replaced by bone. And so here's a nice picture showing the different fontanelles on a fetal skull or infant skull. At the very top, looking from the top down, we have the anterior fontanelle. This is probably the most commonly known of soft spot, but there is also the sphenoidal fontanelle, the mastoid fontanelle as well on either side. The vertebral column is what makes up the rest of the axial skeleton, and it consists of the vertebrae and the thoracic cage. The vertebral column or spine consists of 26 bones, 24 of which are vertebrae, and a fused sacrum and a fused coccyx. The vertebral column provides a column of support which will transfer weight to the appendicular skeleton of the lower limbs and protection of the spinal cord, and it helps maintain an upright body position. The vertebral column is subdivided on the basis of vertebral structure. The cervical region of the neck has 7 cervical vertebrae. The thoracic region has 12 thoracic vertebrae, and the lumbar region has 5 lumbar vertebrae. The sacral region has 5 fused vertebrae in the sacrum, and the coccygeal region also is made up of about 3 to 5 fused vertebrae in the coccyx. Notice the vertebral column is not straight and rigid, it has spinal curves. The primary curves project posteriorly and include the thoracic and sacral curves. These are curves that are present at birth. The secondary curves project anteriorly and include the cervical and lumbar curves. The cervical curve develops when the baby starts to hold his or her head upright on their own, and the lumbar curve starts to develop as the child starts to sit or stand on their own. This figure shows representative vertebrae from the 3 different regions of the vertebral column, and that is a superior view. So we're pulling one out and looking at it from the top down. Some of the features include vertebral bodies that bear the weight and are separated from each other by intervertebral discs. The vertebral arches form the posterior margin of the vertebral foramina, which form the vertebral canal. Vertebral arches have walls called pedicles and roots that are called laminae. The transverse processes project laterally or dorsolaterally from the pedicles, and the spinous process projects posteriorly from the lamina. The inferior and superior articular processes arise at the junction of the pedicles and the laminae on both sides of the vertebrae. Vertebrae contact one another at the articular facets, and they form the intervertebral foramina. So let's take a look at each one of these regions or sections of the vertebral column, starting with the cervical vertebrae, the vertebrae of the neck. So again, there are 7 cervical vertebrae. The body, the vertebral body of these vertebrae is relatively small and oval-shaped, somewhat concave. The vertebral foramina gradually decrease in diameter but are relatively large compared to other sections of the vertebral column. The spinous process is stumpy, sometimes with a notched tip. The transverse process have a transverse foramina, and these spaces protect blood vessels that go to and from the brain. Of special note is C1 and C2. So C1 is named the atlas because it holds up the head or articulates with those occipital condyles of the occipital bone. This is going to allow for this specific nodding yes movement. Is the atlas cool? Oh yes. C2 is the axis, and this has a projection that points up towards the atlas called the dens or the odontoid process, and this allows for the rotational shaking of the head no. Thoracic vertebrae come next, and there are 12 thoracic vertebrae, 1 for each pair of ribs. The thoracic vertebrae have a heart-shaped vertebral body, and it has a long, slender spinous process that points inferiorly. It has costal facets that articulate with the ribs. The lumbar vertebrae is the last section of your typical vertebrae. So there are 5 lumbar vertebrae. The vertebral body is significantly larger in the lumbar vertebrae and thicker, much more oval. It has a massive stumpy spinous process and a blade-like transverse process. Moving inferiorly, we have the sacrum, which again is typically about 5 fused vertebrae and protects the organs of the pelvic cavity. It has lateral articulations with the pelvic girdle. The narrow caudal area is the apex, and the superior surface is the base. The base has the sacral promontory. This is where it's going to articulate with those lumbar L5. The sacral canal runs down the posterior surface and the sacral foramina on either side of the median sacral crest. The coccyx has 3 to 5 fused vertebrae and provides attachment for muscles of the anal opening, sometimes called the tailbone. The skeleton of the chest or the thoracic cage protects the heart, lungs, and other internal organs and serves as a base for muscles involved in respiration. The thoracic cage is made up of thoracic vertebrae, ribs, and the sternum. We have 7 pairs of true ribs called vertebrosternal ribs, and these are going to connect to the sternum with costal cartilages. We then have 5 pairs of false ribs. Pairs 8 through 10 are vertebrochondral ribs because they articulate with the vertebrae and the costal cartilages instead of the sternum. The last 2 pairs are called floating ribs, or better described as vertebral ribs. The sternum actually is made up of 3 parts. The superior broad part is the manubrum, which articulates with the clavicle of the appendicular skeleton and with the longer middle section called the body of the sternum. The most inferior tip of the sternum is called the xiphoid process. So we've reached the next checkpoint and the end of this recording, and I'm wondering if you would know what signs you would expect to see in a person suffering from a fractured hyoid bone. So see if you can do it from memory, otherwise flip back to the very beginning of these notes in this lecture recording.